Hello, guys, welcome back to Being Medic. Today, we have an important topic to discuss the Glasgow Coma Scale. This simple yet powerful tool is used by healthcare professionals to assess a patient's level of consciousness after a head injury or other neurological conditions. So, let's dive in and learn all about it. The Glasgow Coma Scale, or GCS for short, is a standardized tool used to assess patient neurological status. It helps healthcare providers understand how severe a brain injury or neurological condition might be. As you can see, the Glasgow Coma Scale assesses three main aspects of the patient's condition: eye opening, verbal response, and motor response. Each aspect is scored on a scale, and the total score provides an overall assessment of the patient's consciousness. Now, let's break down the scoring of Glasgow Coma Scale. The eye opening aspect is scored from 1 to 4, with 1 being no eye opening or 4 representing spontaneous eye opening. The verbal response is scored from 1 to 5, ranging from no response to coherent conversation. Lastly, the motor response is scored from 1 to 6, indicating no response to purposeful movement. If we go for overall scoring, then here is the chart. Firstly, we can see eye opening response. 4 is spontaneous eye movement. 3 is to speech. 2 is to pen. And 1 is no response. And now we talk about verbal response. As we can see, 5 is oriented to time, person, and place. 4 is confused. 3 is inappropriate words. 2 is incomprehensible. And 1 is no response. Now let's see motor response. 6 obeys command. 5 moves to localized pain. 4 flex to withdraw from pain. 3 abnormal flexion. 2 abnormal extension. And 1 no response. These are the overall scores for patient's condition. We can assess a patient over these. It is essential to understand how to use the Glasgow Coma Scale correctly. When assessing the patient, you will observe their eye opening, verbal response, and motor response. Then assign the appropriate score for each aspect. The total score will help determine the severity of the neurological impairment. Let's discuss what this score means. Scores on the GCS range from 13 to 15. The higher the score, the better the patient's neurological function. Scores below 8 are considered severe, 9 to 12 are moderate, and 13 to 15 are mild. The GCS is widely used in various clinical settings. For emergency departments to intensive care units, the GCS helps healthcare providers make critical decisions about patient care, including the need for imaging, surgery, or transfer to a specialized facility. Like any medical tool, the Glasgow Coma Scale has its limitation. It is important to be aware of these limitations and use clinical judgment alongside the GCS. Additionally, variation of the scales may exist, but the original GCS remains the most widely accepted. As we wrap up today's episode, let's summarize what we have learned about GCS. The GCS is a vital tool for assessing a patient's level of consciousness for a neurological injury. It involves scoring eye opening, verbal response, and motor response, with lower scores indicating more severe impairment. Healthcare professionals use this scale to make critical decisions about patient care. Thank you for joining us today on Being Medic. We hope this episode helped you understand the GCS better. If you found this video informative, please give it a thumbs up and consider subscribing for more medical insights. As always, stay curious, stay informed, and stay healthy. Thank you for watching.